Health is one of the most important assets that a human can ever possess. Hi dear viewers, good evening. Welcome to yet another fresh episode of BMC Global Live AL-HILAL Health World. I'm Gauri here with you, and today with us to talk on hemorrhoids, we have Dr. Krishnakumar Raman Iyer. He has 30 years of work experience and is currently working in AL-HILAL Hospital, Riffa. He is working as a general surgeon and is specialized in colorectal surgery. He has passed out in 1990 from Grand Medical College, Bombay. Hi doctor, welcome
Hello.
to the show.
Very happy to be once again with you.
Yes doctor, I hope you're doing well again.
Fine, thank you.
So doctor, in the previous episode we had talked about anal fissures.
Yes.
So today we'll be talking about hemorrhoids.
Yes.
So we know that hemorrhoids is piles, but then we are not exactly sure about the term. So could you please explain it?
Yes. Hemorrhoids are a leash of blood vessels which are normally present in every individual. Normally it's at 3 o'clock, 7 o'clock and 11 o'clock. If we consider the anal canal to be like a clock, so 3 o'clock, 7 o'clock, 11 o'clock, blood vessels are normally there. But because of various factors, they become more bulged out and it comes out of the anal canal and it bleeds, then it is called as hemorrhoids. The word hemorrhoids, hemorrhoes, means flowing of blood from the anal canal. It's also called as piles because it's like a bunch of grapes. Piles means a grape.
Yeah.
So these are hemorrhoids.
So what are the different grades of hemorrhoids?
See, hemorrhoids are, as I told you, this leash of vessels is normally there in every individual. But when it becomes symptomatic, then it is called as hemorrhoids. So when the hemorrhoids protrude, when the hemorrhoids are there inside and you cannot see them and blood is coming, then you know that it is grade 1.
Okay.
If the vessels, if that bunch of hemorrhoids are coming out and goes back inside the anal canal, it's called as grade 2.
Oh.
Grade 3 is when it's coming out of the anal canal but doesn't go back after defecation. This is called as grade 3. There's also a grade 4 which is called as prolapsed, thrombosed, infective hemorrhoids. So there are 4 grades of hemorrhoids.
Okay, so are they classified more?
Yes, hemorrhoids are classified into internal hemorrhoids and external hemorrhoids.
Oh.
The word internal means what? It is inside.
Yeah.
You cannot see them outside.
Yeah.
And external means which are seen externally.
So doctor, what could be the causes by which this hemorrhoids could occur?
Hemorrhoids, till now, not everybody knows the precise and the exact cause of the formation.
Okay.
But many people postulate that anything which increases the pressure in the abdomen and thereby leading to increased pressure in the anal canal predisposes to hemorrhoids.
Oh.
So what are the things which causes increase intra-abdominal pressure? For example, pregnancy in women. Because the baby inside pressing on the vessels, there's increased abdominal pressure.
Okay.
Somebody is doing a lot of weightlifting for a long time, it predisposes to hemorrhoids.
Oh.
Prolonged constipation because of eating too much of non-vegetarian diet with less of fibers, they predispose.
Yeah.
Many of the times, sitting in the toilet, nowadays, you know, the toilets are becoming more and more fashionable. So people spend more time in the toilet, they sit inside, they read the mobiles, they read the magazines and they sit without even realizing. Such prolonged sitting in the toilet for a long time predisposes to hemorrhoids.
Okay. So doctor, is there any gender barrier between male or female when it comes to hemorrhoids?
No, there is no anybody and everybody, be it male or female, they can get hemorrhoids. Generally over the age of 40 years.
Okay. So what are the main symptoms of hemorrhoids?
The main symptoms of hemorrhoids are bleeding per rectum, which is painless.
Okay.
Like last time we told you, when there is bleeding per rectum but it is painful, it is generally fissure in anal. But if a person is having bright red blood passing out of the stools while passing motions and it is painless, then we can say that this is a hemorrhoid.
Okay.
So this is the first symptom. Second symptom is it depends upon whether it is internal or external hemorrhoids.
Okay.
External hemorrhoids, patients will complain of some mass coming out of the rectum. They can be itching, they can be little burning in that area.
Okay.
Sometimes there can be severe pain in piles also, but this is very, very rare. For example, thrombosed hematoma. Hematoma means there is a clot which is occurring in the piles outside, can cause severe pain.
Oh, okay.
Patients may have constipation, which is the cause of the hemorrhoids. And itching, pruritus ani, is also the other symptom of hemorrhoids.
Can hemorrhoids cause cancer?
No, hemorrhoids cannot cause cancer, but hemorrhoids can be present in a person with colorectal cancer. Not any cancer, cancer of the colon and rectum can have piles also, and that is why it's very important to rule out something more, what do you call, more dangerous, more complicated like cancer.
Yeah.
So a surgeon has to be aware of the fact that piles may not be primary, it can be secondary due to some other cause.
Okay. So doctor, now we'll be going for a short break. So dear viewers, we'll be going for a short break now. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. We'll be back. Welcome back dear viewers, I'm Gauri here and you're watching BMC Global Live AL-HILAL Health World. With us we have Dr. Krishnakumar. So we are talking about hemorrhoids. So doctor, again welcome back. So doctor, what are the different treatments or modalities for hemorrhoids?
Yeah, the various treatment modalities can be classified as non-interventional and interventional.
Okay.
So non-interventional is basically trying to go against the cause of these hemorrhoids.
Yeah.
If constipation, prolonged straining at stool is the cause of that hemorrhoids, then what we should do is we should attack that first.
Yeah.
So by giving stool softeners or laxatives, what happens is the constipation is removed. Then patient is able to pass motions very nicely. Second thing is if the patient has a very, very bad bowel habits, he goes and sits in the toilet for a long time, we should advise him have proper bowel habits. Maximum time should be spent in the toilet is maximum 5 minutes. Do the job and come out. We should not just enjoy the toilet with all the various things which you have there. Then anti-amoebic line of treatment goes a long way in also helping in reducing the hemorrhoids.
Okay.
And now we come to the interventional.
Yeah.
So the interventional means a surgical intervention. Now depending upon the grades, there are various interventional methods. If it is grade 1 hemorrhoids, along with whatever I told you for the dietary measures, more fibrous diet and all, for the first grade hemorrhoids, we do what is called as injection of sclerosins into the hemorrhoids.
Oh, okay.
We use phenol in almond oil or sodium tetradecyl sulfate. If it becomes grade 2 hemorrhoids, then we do what is called as banding of hemorrhoids.
What is banding of hemorrhoids?
Banding basically is we put a rubber band at the root of the hemorrhoids and it causes necrosis of the hemorrhoids and the hemorrhoids fall away. Now the patient has got 3 hemorrhoids, 3, 7 and 11. We should not do banding at the same time for all the 3 hemorrhoids.
Okay.
Every week we should do 1. It takes around 4 to 5 days time for the hemorrhoids to necrose and fall off. So when it falls off, the next time again we do the second one and then the third one.
So can this cause pain?
Yeah, because there's not much innervation by the nerves, it's not very, very painful.
Okay.
That's why the main symptom of hemorrhoids is not pain at all.
Yeah.
So when you do banding, there can be a little bit of irritation in that area, that's all. There's not any pain at all.
Okay. So what are the various other modalities?
See, various other modalities are, we can do what is called as infrared coagulation at the root of the hemorrhoids. There are many other people who have what is called as ultrasonic ligation of blood vessels in that area. And then of course there is surgical treatment.
Okay.
Surgical treatment can be various. The classical Milligan-Morgan operation called as dissection ligation of the hemorrhoids is a time-tested procedure. Nowadays there are various other modalities of treatment which are available, which is in the form of stapler hemorrhoidectomy. It's relatively new, about 10 years old, where a circular sheath of rectal mucosa is cut off and it is anastomosed with the help of stapler. So it's done under general anesthesia and patient can go home the same day evening. There's no pain, nothing as such.
Oh, okay. So is the surgical method suggested at the later stage or the earlier stage?
See, surgery should be always kept at the last.
Oh,
Try
okay.
to do the alleviate the causative factor. That's if a person is constipated, tell him to avoid non-vegetarian diet, give him a lot of high fibrous diet, and then we give these stool softeners. And if we give anti-amoebic treatment, and in spite of this, if it is not there, then we give injection, banding, infrared coagulator. If suppose all these fail and patient is losing lot of blood, then it is better to go in for surgery and do it. So surgery should be done at the last.
What major role does diet play in this hemorrhoids?
Yeah. See, we have seen that people who are predominantly non-vegetarian eaters, they have all these complaints of hemorrhoids. Okay. It is not that vegetarians don't have, but the percentage is much less. Okay. So, we should try to have a diet which is high in fibers.
Oh, okay.
Okay, so a vegetarian diet goes a long way. Have a lot of salads, restrict the amount of non-vegetarian diet, avoid refined flour.
Oh, okay.
Okay, refined flour removes all the roughage from that. So patients who are going on eating, or other persons who are eating refined flour, yeah, they tend to get constipation, and because of that, there is hemorrhoids. So okay, diet, a healthy vegetarian diet or a non-vegetarian with lot of salads, with more of non-refined flour goes a long way in preventing of hemorrhoids.
So doctor, with that we come to the final question of what are the take-home messages that we could give to our viewers.
Yeah, the take-home message is try to avoid constipation at all costs.
Okay.
How do we avoid constipation? By eating more of a fibrous diet, reducing the amount of non-vegetarian diet, cultivating healthy bowel habits, like going at a particular time, staying for a few minutes in the toilet. It goes a long way in treating hemorrhoids. Okay. And if you have bleeding, don't think, go immediately to the surgeon and tackle it.
Okay, doctor, thank you. With that, we came to the end of our set of questions.
Thank you.
Okay.
It was a very nice time here with all of you. Thank you so much.
Same with you, doctor. It has been a great pleasure to be here. And
yes,
thank you so much for taking your time off from the busy schedule.
It's a pleasure. Thank you so much. Bye-bye.
So, dear viewers, that's it for today. We'll be winding up this episode. We had talked about hemorrhoids and also various other take-home messages. I'm sure you'll follow them all. Thank you so much for watching. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. This is Gauri signing off. Good night.